My name is Sarah, and I'm a pelvic health physical therapist. I've been with Franciscan Health for 21 years now, starting in orthopedics and sports medicine, and over the past decade have really found a specialty area in pelvic health. Women who are pregnant can absolutely benefit from pelvic floor physical therapy. And as we know, our body changes significantly during pregnancy and things stretch and move that typically haven't moved in that direction in the past. And so what we can begin to experience is some lower back pain, some pelvic pain, even some pubic symphysis pain. And that pain can be pretty disabling. It can affect our ability to sleep and care for our other children. It can impact our ability to work, which is really important. And so pelvic health physical therapists are able to evaluate and see if there are movement patterns that have developed, or maybe help talking through fear, right? It's very scary to be pregnant, and sometimes any ache or pain that we feel can make us hesitate to do a movement. But what we know and what research shows is that staying active and staying mobile helps us not only have a better pregnancy, but a better delivery and a faster rehab postpartum. So during the postpartum time period, that's a really special time for new moms, and a time where we sort of feel like life should go back to how it was, before we were ever pregnant. And what many of us moms find is that things aren't the same. And so we can begin to experience some different symptoms. Maybe our abdominal wall has some separation that we didn't know could even happen, and we're feeling weak and having difficulty getting out of bed. Maybe we've been surprised and had a C-section and hadn't planned on having an abdominal surgery and realized the implications of that. So postpartum rehab for moms who've had any trauma during their delivery or having any aches or pains that aren't resolving, they can absolutely benefit from referring themselves postpartum. So that they realize that they do have the strength and the capability of rehabbing these muscles just like from any other injury or just like from any other trauma. We can teach them how to strengthen both their pelvic floor, their abdominal wall, and get them back to their prepartum habits and exercise. If we want to begin to wake up some of the muscles that were most impacted by delivery, there's sort of two key areas that we want to focus on, and that would be our pelvic floor muscles, which are the muscles that run from our front pelvic bone back to our tailbone, and they sort of serve like a bowl or a hammock and provide a lot of stability and support to our bladder. And so that's where we want to talk about doing a little bit of pelvic floor strengthening. You might have heard this called Kegel exercises. And so when we're talking with moms about how to best connect with these muscles, imagining as though you were going to stop your urine flow midstream and feeling those muscles draw up and in, and connecting with that feeling and then releasing. We can think about beginning to tighten our abdominal wall muscles. So this is the second muscle group that's really important to begin to wake up post-delivery. And how you might connect with those muscles is we imagine as though we're zipping up tight pants and we're drawing our abdominal muscles in, or almost drawing our navel towards our spine and hollowing out that space in between our hip bones. And when we first start doing this postpartum, those muscles are going to feel like they don't want to work at all. But I promise you, a little bit of work every day, and within a few weeks, you'll find yourself connecting with those muscles so much better. If you feel that you could benefit from a pelvic health evaluation by one of our Franciscan physical therapists, visit our website at franciscanhealth.org/rehab.